Good morning, everyone. A very warm welcome to today's webinar brought to you by the IGCP Group. We are delighted to have with us an insightful and extremely relevant session, especially for those involved in women's health and reproductive care. Our topic for today is non contraceptive benefits of hormonal contraceptives, what every gynae should know, a subject that continues to evolve and hold critical importance beyond just birth control. It is my great pleasure to introduce our esteemed speaker for today, Dr. S. Sujit Sir. He is a senior consultant in the Department of Obstetrics and Gynecology at the prestigious PD Hinduja Hospital, Mumbai. He holds an MBBS and is a diplomat of the National Board in Obstetrics and Gynecology. His academic credentials also include a fellowship in minimal access surgery from the World Association of Laparoscopic Surgeons and a diploma in gynecological endoscopy from both Kiel University in Germany and the IRCAT in France. Apart from his clinical experience, he is also a prominent voice in public health education. His podcast channel, Guy from Gynac, has been making waves across social media platforms, shedding light on sensitive women centric health issues with both empathy and evidence based clarity. So, with this very brief introduction of him, I would now request Sir to please start for the topic for today. Over to you, Sir.
Thank you. Good afternoon, everyone. So today we'll be talking about non-contraceptive benefits of the hormonal contraceptive pill. So contraceptive pills are something that we use very often in our practice. As a gynac, I guess everyone would be using it every now and then. So we all know that contraceptive pills contain estrogen and progesterone. These are the synthetic ones that we use it. There are even some contraceptive pills that contain only progesterone, that is progestin. Depending upon various scenarios, we decide when to use a combined hormonal contraceptive pill or when to continue only using progesterone contraceptive pill. We know that this is one of the commonest things or the commonest methods by which we can offer birth control to our patients. But apart from the birth controls that we use, it is also used for other things that we will be discussing today, and that is the non-contraceptive benefits. Coming to this is how a pill might look, or it might be looking something else. There are a lot of backlashes when it comes to pills. So this is something I would start with. That since 1960s, that's the first time when the pills were introduced. The scare has remained regarding the pills, and which is there. Like when 1960s that the pills were started, nobody knew the proper dosages, and that led to a lot of vascular complications, including strokes, or it also led to higher risk of cancer that we have heard about, and that is what the patients still remember. So it is very important to motivate your patient when it comes to contraceptive pills and to also use it freely, because these are something which is fantastic and it gives you a lot of other non-hormonal benefits, non-hormonal birth control benefits which are there. That is what we'll be talking about. So before starting with the discussion, this is something I expect everyone to know about. So this is the basic menstrual cycle that happens for a woman, and this is why targeting at different levels that we can work on it. So we all know that there are hormones which are produced by the hypothalamus, by the pituitary, and by the ovaries, which is the GnRH, the FSH and LH, and your estrogen and progesterone. These are multiple levels at which the hormones will be acting, and in general, it acts the overall in the entire body. And we have those changes that happen in the uterus, which is the menstrual phase, the follicular phase, the ovulated phase, and the luteal phase. This is what we hear from the patients. So the patients basically complain about these aspects, that yes, my period has become irregular or the bleeding pattern has changed. So they are targeting only the uterus. But as gynacs, we should also be aware about the ovarian cycle and about the hypothalamo-pituitary ovarian axis or the HPO axis. So once you take a detailed history of the patient before starting any pill, you should be taking a proper detailed history where you rule out the negative aspects, or where you rule out the eligibility criteria and the non-eligibility criteria, which include that the patient should not be a smoker, should not have migraine, should not be hypertensive, should not have risk of breast cancers in the family. And those patients who are not fitting into the criteria are the actual patients where you can think about starting with the birth control pill or the oral contraceptive pill. So that's a basic background of where you or how you select regarding the OC pills. Yes, OC pills or the birth control pills are meant to be the primary contraceptive method when you have to think about birth control. But as per the discussion for today, we'll be thinking about the non birth control options that we have along with this. So we often have patients who come with irregular cycles where the patient is not having her periods between every 24 to 45 days, and then we say that the cycle can become irregular. For these patients, we can control the birth control pill, which obviously, if you can depend upon whatever pills that you're using, whether it's a 3 week pill with a pill free interval or with placebo pills, those are the ways that you consider starting it. Once you know that this is how the period is going to happen, the patient knows that my period will happen every 28 to 30 days with the pill. And it's during the non hormonal pill or non pill day or with the placebo pills. That's when the patient will know that this is the timing when my periods will happen. The patient also has a good idea regarding her periods, and you can start with this, and the patient is symptomatically better. So the length also can be increased. So nowadays we have even the smaller dose pills, which are there for 24 days, with a pill-free interval or a placebo pill, which is there for 4 days, and the patients bleed during that period. So either you do a 21-day with a placebo pill for 1 week, or you do a 24-day with a placebo pill for 4 days, and that is when the periods will happen during the pill-free or the placebo time. So the patient knows that I'll be bleeding during these periods. And the best part is if you have the 24 plus 4, there are certain ways where you can even increase the pill free interval or the period interval. So what you do is basically you take the 24-day, and without taking the 4, you add another 24. So then you have actually 48 days without periods, and during the next 4 pill free interval or the placebo period, that's the time when the patients can have a period. So this you can go in for 3 cycles. So basically, what you need to understand is the patient under your guidance can have 24, 48, or 72 days where there will be no period, and the patient will bleed only on those 4 days when the patient takes the pill-free area or the placebo pills. During that time, the patient will be having a period. So if you look into that, this is something which you can do wonderful for a patient, someone who is traveling or someone who has some exams or someone who wants to avoid her period because of religious reasons. So all these things can be achieved where you can regulate the menstrual cycle for your patient according to the pills. And that is something I guess it's very convenient whenever you have to decide as a doctor, and something which is tried and tested and very convenient for the patient also. So that's the first point, regulation of your menstrual cycle. Irregular cycles or unpredictable cycles are also something which is very dicey. The patient doesn't even have a proper idea that whether my periods are going to come during that period or whether it can happen anytime randomly, or if the lining will be very thick because it's delayed and that patients can have heavy bleeding. So all these things are important. The other thing which becomes important in this part is when you think about PCO. So the major reasons why we discuss the non-contraceptive benefit of OC pills are because you want to tackle a patient with PCO. So whenever you have a heavy bleeding or whenever you have irregular periods, what you need to know, again going back to the diagram that we had seen regarding the menstrual cycle, if there is no proper balance between estrogen and progesterone, which happens majorly in cases of PCO, so what happens is your uterus is exposed to a very high amount of estrogen, and there is no progesterone because there is no ovulation which is happening properly.
I would request all our audience to please be patient. I think there is some network issue from Sir's end. So kindly bear with us. As soon as Sir joins, we'll resume the session. I would request our attendees to please be patient. We are trying to connect with Dr. Ashley sir, and as soon as he joins, we'll start the session there.
Can you hear me?
Yes, sir. Yes, I can hear you. Kindly continue, sir.
Where did we lose out the slide? I don't know. I'm not sure.
Sir, can you upload the slide again?
Yeah, sure. Just a second.
Yes, sir.
Tell me which slide we lost into. I'll start from there.
Yes, sir. Just a minute. Sir, a treatment of irregular periods.
Lost me from there. That
Uh,
was the second slide.
1 minute, sir. 1 minute, I'm checking. Yes, sir. Treatment of irregular periods. You were at the.
That means like 15 minutes you lost me there. You lost me for 15 minutes.
Sorry, sir.
You lost me for 15 minutes. So that's almost the big. That was the beginning of my discussion.
Okay.
Okay. Cool. Anyway,
So you can
starting then fast.
continue, sir.
Yeah.
From wherever
So
you.
treatment of no, I'll just finish it off with this. We'll just do it quickly. I'm very sorry we lost connection. So treatment of irregular periods. We all know that periods are managed by the oral contraceptive pills. Also, the birth control pills affect on your estrogen and progesterone, and estrogen and progesterone are important in maintaining a regular cycle. Whenever we are discussing about treatment of irregular periods, we are discussing about something very common, that is PCOS or polycystic ovarian syndrome. What you need to know that the periods are a little haywire whenever you manage a patient with PCO. So that is because of the improper progesterone, because of the lack of ovulation or improper ovulation that happens in such a case of PCO. So when you give a birth control pill, you have a regulated dose of estrogen and progesterone which goes around for the patient, and therefore the cycles also become better. The most important part whenever you're dealing with a patient with PCOS is that whenever you have PCO, the ovulation doesn't happen well. So the uterus is exposed to a very high amount of estrogen, and that high amount of estrogen can lead to a risk of endometrial cancer later on in life. So whenever you're giving a birth control pill for a PCOS patient, it is important that you tell the patient that the major reason of starting the OC pills is not just to regulate the cycle, but also to reduce the risk of uterine cancer or endometrial cancer later on in life for such patients. In cases of heavy periods, which are menorrhagia, where the patient has high amount of bleeding because of different reasons or because of some pathology, there is a reason why we start with birth control pill is because the progesterone which is there in pill will make the lining thinner. And if the lining is thinner, the patient will bleed less. In fact, whenever you start with a very low dose pill, the cycles will be so that the bleeding might not even occur during the pill free period or the placebo pill period. And this is something you need to tell the patient because somehow Indian women love to bleed and they want their bleeding to happen properly. But these are something that you can do for a patient where whenever you start with the birth control pill, the period bleeding will be less, the amount of bleeding will also be less, and the patient will also experience some cycles where the bleeding will not also be there. This is something which we are also achieving with Mirena, but this is something we achieve with the birth control pill also, which you need to tell the patient. Dysmenorrhea is basically your painful periods, which is one of the reasons of a lot of other symptoms. You might have a primary dysmenorrhea, or you might have a lot of secondary dysmenorrhea because of fibroids also. Prostaglandin, which is reduced by the uterus during periods, can cause the uterus to contract more, and the menstrual cramping can be intense for some women and leads to loss of work days from work, or it can be also leading to loss of school days. So birth control pills also reduces the prostaglandin by preventing ovulation and thus achieve relieving in the menstrual cramping. Now we come to painful menstrual cycles, like we were discussing. Endometriosis or fibroids are the major reasons, and I guess every day we come across at least one patient who might have endometriosis or fibroids. So endometriosis is basically the lining of the uterus, which can grow apart from the uterus lining. It can grow anywhere else, which can lead to a lot of pain, which we know about. As we know that the progesterone which is there in the hormone will cause the lining to become thinner, not just in the uterus, but in case of endometriosis, it will also limit or reduce the growth of endometriotic lining at different areas which can be present. And in such way, it can also lead to different levels of pain reduction in case of endometriosis. Because of the non-pulsatile manner of the hormones, also it will reduce in the prevent the growth of the fibroids in general, and therefore the fibroids not growing will also reduce the painful cycles. Therefore, it is also advised in case of endometriosis and fibroids that oral contraceptive pill will be helping in reduction in the pain. PMS is premenstrual symptom. PMDD is premenstrual dysphoric disorder. It is a variant of PMS which can include till suicidal tendencies. This is something which is now coming up. You need to know that this is something which happens because of ovulation and because of progesterone hormone. Since we are giving a birth control pill, we maintain a steady level of progesterone. Therefore, the patient does not experience PMS or PMDD. Whenever you're considering on starting over in the oral contraceptive pills, what you need to know that certain patients, though we say that it can reduce PMS and PMDD with the OC pills, certain patients might have a little more exacerbated PMS symptoms. In such patient, the patient will be then asked to stop the OC pill. So whenever you start with an OC pill, tell the patient that if something like this happens, please let us know. If symptoms are better, if the patient is feeling good, then nothing like it, the patient can continue the OC pills till the time she wants. Now coming to the androgenic pattern, PCO, we know that there is a variation in the FSH and LH hormone, and that will also lead to an imbalance between male hormones and female hormones. The male hormones include your serum testosterone, serum DHEA, DHT, DHEA. So all these hormones, when it rises in comparison to the estrogen levels which are there in the body, or in general compared to the normal levels, it can lead to androgenic pattern in the patient, where the patient will have acne, the patient will have excessive hair around the body, which can be around the lip, below the chin, between the breast, between the belly button and the pubic bone, or around the inner thigh. That is called hirsutism. Or the patient might have hair loss according to the male pattern, which is called alopecia, where the patient will have central thinning or the forehead thinning of hair. When you start with an oral contraceptive pill, though there are other pills which also are recommended, but oral contraceptive pills also have shown to reduce this circulating testosterone and testosterone derivatives in the female, and therefore it reduces the risk of acne, hirsutism, and alopecia. What you need to say the patient that acne is something which will be cleared out very fast. So within 1 to 2 months of using the OC pills, the patient will show symptomatically better skin and acne reduction happens. But when you're starting with an OC pill for the hair growth and the hair fall, the patient needs to wait for at least 3 months till 6 months where the target is achieved. If even after that, if the patient is still showing some male pattern hair growth or hair loss which has happened, the patient should see a gynecologist to rule out any other reasons of having a higher testosterone in the circulation. I already told you about that. OC pills are helpful in reduction of endometrial cancer. It is also shown that OC pills reduce ovarian cancer and colorectal cancer. With a very basic level of hormones in the body and non-pulsatile level, it also reduces the breast heaviness or the breast pain which is seen during the periods, and therefore it also reduces the risk of benign breast disease. What you need to tell the patient, or what you need to know as a doctor, is you need to identify your patient well. In cases of breast cancer risk for the patient or in the family of breast cancer, you need to use your OC pills very wisely. But otherwise, when you give them an option of OC pills reduction of these cancers, the patient will be very happy into taking the pills. It is seen that OC pills also increase the bone density and has a positive impact on bone health, especially in young women, because of maintaining a healthy hormone balance. These are various studies which have shown that yes, OC pills are also important to reduce the risk of osteoporosis later on in life. The idea across this is whenever you have a patient with premature ovarian insufficiency or premature menopause, we do start with some amount of estrogen and progesterone for the patient. Similarly, in young women who have an irregular hormonal cycle, they may be prone to getting osteoporosis sooner compared to any other woman. So, whenever you are starting with an OC pill, thus hormonal balance is also maintained, thereby reducing the risk of fractures later on in life. And coming to the most few important parts is that whenever you make sure that the periods are not very painful, the cycles are not irregular, and the patient is not bleeding for a longer period, the patient will also have a good amount of hemoglobin and thereby reducing the risk of anemia. And the most important thing, what I always tell my patients is that if you're not in the zone of planning for a baby and if you're not thinking about having any pregnancy soon, then why do you want to bleed? Why do you want to go through the pain? Why do you want to have your PMS and everything? So, therefore, once starting with the oral contraceptive pill, what you achieve for the patient is independence, and that is what we give to the patient. So, this is one of the final briefs that we talk about. So, whenever I decide for a patient regarding the OC pills, and whenever there's a question that why OC pills, I always tell them that it's not just the contraceptive benefit, but there are 10 other reasons why I'm starting it for you. So, when I give them that example that I want to reduce the excessive hair growth or excessive hair fall that happens for you, I want to make your skin better by reducing your acne. I make sure that you don't have any painful breast. I make sure that you don't have any PMS. I make sure that you don't put on weight. And in fact, you have decreased bloating, which can happen because of the periods and the irregular cycles. I make sure that you don't have heavy menstrual bleeding. I make sure that you don't have painful cycles. I make sure that you don't have any risk of any cancers later on in life. And the ninth thing is I reduce the risk of anemia. And the most important thing, like I told you, I'll give you the independence. Once you know these 10 points and you can tell your patient that it's not just for contraception, but these are for the other 10 things that I'm doing it for you, the patient will wholeheartedly agree on taking a birth control pill or oral contraceptive pill and achieve the non-contraceptive benefits which are there with a birth control pill. So with that, I would end with the quote that you cannot have maternal health without reproductive health. So whenever you're thinking of starting with any oral contraceptive pill, think about the journey that the woman will be going through the entire pill in period and the benefit that you will be achieving even later on. And the patient will definitely ask for a pill whenever you suggest for them. Thank you.
Thank you so much, sir, for your insightful presentation.
Thank you. I'm
Uh,
sorry there was a miscommunication and lack of network issues. So that is where we lost the track, but I guess we finished everything.
yes, sir, not an issue, sir. We'll not take more questions. We'll wrap it up within the next 2-3 minutes. So, just a
Sure.
few questions, sir. So, the first question is so, in the age of social media and misinformation, what role do you think platforms like your podcast can play in bridging the knowledge gap among women?
So this is something which is very common that patients hear about a lot of pill related issues. So you start with the history that yes, I always tell you, like I told you also that pills were introduced in 1960s and currently we are in the fourth generation of pills. And I'm sitting here after years of research, after years of patient experience that I know that you will be getting these benefits. So and you tell them the 10 things like I told you about that these are the benefits that you can achieve just apart from giving the contraceptive reason, you have these other benefits that can happen. And if you select your patient history well, and if you tell the patient that you don't have any comorbidities which help me to not start a pill or think that I should be starting a pill for you, once you tell the patient these things, the patient will have trust in you and will move ahead compared to whatever things are going on the social media.
One more query, sir. Do you believe the risk of thromboembolic events is adequately addressed when prescribing COCs for therapeutic use?
Yes, that is done. So whenever you start with the pill, always do a preliminary investigation for the patient. My patients, they always get the liver function testing. They always get a PT, the coagulation factor testing, the CBC testing, which is done on a basic level. There are certain risks. Again, the history taking becomes important in a family of stroke, or if you have anyone who's had a vascular complication that has happened in the family. So the important thing is proper history taking, irrespective of if you're managing a patient with OC pills for any other reason, or be it anything in your practice. Once you have taken a proper history for the patient, then I think you can be choosing any drug, any medication, and it will definitely work better for your patient.
So we'll take one last query, that is, how do you counsel patients who are hesitant to use hormonal contraceptives due to myth or fear, especially for non-contraceptive indications?
So first, I always start with so whenever you my paper has the history which is there, and then I start with the planning. So first, start with non-hormonal things, obviously. So if you think that certain things can be working out with non-hormonal aspects, then you think about that. If it's something like a tranexamic acid or primrose oil that you can use, or some supplements, work on that. But if the patient is not improving, then you always explain it in the first consultation itself that I will be considering birth control pills. They are completely safe. I have been using it. So I always tell them that the youngest patient of mine who's on a birth control pill is 11 years old. The longest I have started a pill for a patient and continued is for 6 to 7 years. The patient is on the pill and no side effects. That's because you're following up with the patient, you're in touch with the patient. And if those are there, complications can happen to anyone. Like even we have heard about mefenamic acid leading to complications also. But then once the patient knows that yes, these things have been done in the patient, in your own patient, then I don't think there'll be any hesitation with all the myths around. It's eventually the trust and the confidence that you develop with the patient and with your practice and your long duration of practice. If you have used it and if it's worked, the patient will also know that yes, this is something which will work for me also.
Thank you, sir. Thank you so much for answering all the queries. With that, we would like to conclude the session. Thank you so much for your time, your effort, and for sharing your knowledge. Thank you, sir.
Thank
Have
you
a good
so
day
much,
ahead.
Arpita. Thank you, Arpita. Thank you everyone for listening. Bye bye.